So I'm Lynn.
I'm Victoria.
And we are the LV Project. So in our, not our last video, but the video before that, well, Victoria had, I had fun being able to hear her sing the happy birthday song. But now that it's going to be her birthday next, happy birthday to you. Happy birthday to you. Woo. Happy birthday to Victoria. Happy birthday to you.
Thank you.
And many more.
Yay, jazz hands too. Thank you guys. I'm getting older, but hopefully wiser. So thank you.
Probably will. You probably will.
Oh, thank you. She's nice.
So what are we going to talk about today?
Oh yeah. So to our topic. If you are interested in healthcare, or if you're thinking about healthcare, or you're just, even though you're not gonna go to healthcare field, but you're interested to know, today we're gonna share about the facts that are going on in terms of healthcare. There are tons of them, but we're just gonna talk about the major ones that we think are important, and it might help you to decide, or might add to your knowledge of of how's the healthcare doing right now, globally, nationally, and personally, since we both are going to go to a healthcare field. So we're going to share to you why we think we've come to the decision to do that. So I'm going to start by sharing to you guys the healthcare facts globally. So when I was doing my research, number one thing that I thought that was important was, so according to World Health Organization, WHO, it's a leading and excellent organization in looking at healthcare issues around the world. So according to WHO, the world is currently short of 7.2 million healthcare workers.
Wow.
Yeah.
I think it's mostly because you have a lot of the third world countries that doesn't have enough doctors and nurses and those kind of healthcare professions, and I think they really would like to that probably would need the most help.
Yeah,
of them all.
That is so true what you said. So like for a specific example, it's like in the 47 countries in of sub-Saharan Africa, just 168 med schools exist. That's a little compared to like what we have here in the US. And of those 168 countries, 11 have no med schools, and 24 countries have only one med school.
Wow.
So part of like what you said, it's because they don't have enough training and education for healthcare providers. That's why that explains the why the world is short of healthcare workers. So that's kind of like the globally. So as you can see, the world still needs and will always need a healthcare provider. Even though you've seen a lot of people wanting to go into medical school or nursing school or other healthcare field, there are so much need outside of the things that we normally see. So Lynn, you're going to talk a little bit about the healthcare field nationally.
Yes.
Yeah.
So for me, when I did my research, I mostly looked on places that kind of pertain only to physicians and other medical staff. However, it can also be for nurses, for dental, those kind of things. So the one thing I looked at was the website AAMC, the American Association of Medical Colleges. I think that's...
Yeah, I think so.
Yeah. So they actually did a recent study, by, I'd say last year recent. They took a study of whether we have a surplus or we have a shortages of physicians in the United States. And from what I've heard, based on the stipulation of you have different factors that play a role in whether or not you can have a lot of doctors or not a lot of doctors in the future. They said that we are in the US, we are still short on doctors, and we can probably still be short on nurses and other healthcare professions, because if you think about it, you have a population of.
By the way, sorry to cut you. Guys, if you're hearing any sounds, it's just the people are cleaning in the back side, so ignore that and listen to our wonderful voice. Yay. Okay, go back.
Is it wonderful?
Yeah,
it's probably wonderful.
So you were saying?
Yes, so back to what I was saying, this can also apply to nurses and dental and all the other healthcare professions, but you have a population of doctors, of nurses, of dentists, of other staff that are going to be retiring later on, and so those jobs are going to be filled by other people. Now think about it this way, a lot of people want to be able to work quickly as possible. So the people, or at least the jobs that require a lot more training, a lot more years of studying, they probably won't be as filled as that quickly. So kind of like surgeons, let's see, internal medicine, things that require about like 4 or 5 years of residency, right after you're done with your 4 years of your medical school or your dental school and whatnot. Those jobs, I believe, tend to be filled up a lot less quickly. So think about that way, and then also think about a lot of the staff that are going to be retiring later on. So some people say we may have a surplus, but I would think we may have more of not enough doctors, not enough nurses, not enough dentists later on.
Yeah. Okay. Yeah, that is such a shock, because we think being surrounded by our friends, which is mostly pre-med and pre-nursing student, because that's everybody's taking the same class. It seems like a lot of people are going to healthcare. But in addition to what you're saying, again, according to WHO, US has fewer doctors and nurses than other high-income countries. So. And then there's many ways to fix it, from different levels, from governmental levels to grassroots levels. And I think our part as a student is, to think about, okay, is this what I want, and then am I good at this, and then go for it. So transitioning from how the healthcare is nationally, now we're gonna talk about how it is personally.
Okay.
Yeah.
Interesting. Well, probably have a lot of reasons why I wanted to become a doctor, but I guess the main point is wanting to help people. Yeah. This is pretty cheesy, but I'm sure a lot of pre-meds out there are probably thinking, I want to help people. For me, I have a sibling that has a medical condition, and so that sibling had to go to the hospital a lot, and so being able to see how doctors and nurses are able to take care of the patient, it made me realize I want to be part of that community to help serve those who are in need. Right now I'm still open to what I want to be, because I'm still unsure.
Like your specialty?
Yeah. I mean, I'm kind of leaning more towards neurology and anesthesiology, but that may change later on.
Right.
So yeah, that's one of the big things why I wanted to be in this field. What about you?
So I'm kind of thinking about the different things why, and then and then I lost my thoughts. So I was just like, okay, let me just talk about these two main things. I think the number one is, like Lin said, it's my passion. I think growing up in a country that so I want to become a nurse, and my two routes, it's either I'm gonna be a nurse educator, so I will be teaching nurses, or I'm going to be a psychiatric mental health nurse practitioner. And again, number one reason is my passion, because growing up in Indonesia, I don't think there is a special nurse educator to train nurses, and there's the people who have mental illness, they don't have a voice of their own. So that kind of built up my passion to why I want to do those two things. And also in the US, we're just lack of both to those specialization of nursing. So, and it's also my passion to teach and to share my knowledge and to serve people through educationally and physically or mentally. So yeah, it has been always my passion, and getting feedback from other people, that getting confirmed, oh yeah, you do have that passion. And then again, the second reason is the thing that I already kind of talked about, is the lack of those two things. So I just want to be able to provide education to other nurses, because right now I think in the US especially, we're also lacking nursing professors. That's why it's really hard to get into nursing school. One of the reasons is because we don't have enough nurse educators. And another thing, also the same thing with psychiatric mental health nurse practitioner, we don't have a lot of them. So I want to contribute in that way, and thankfully it also matches my passion, so that's always great.
Nice. So even though we have our times where our passion to want to help others motivates us, there are times when we have our doubts of, are we sure we want to be a doctor or a nurse? Because oftentimes we get hit by realities of,
with schools,
organic
chemistry.
Yes. Actually, I'm actually doing pretty well in organic chemistry.
I know, she's good.
So.
On my,
I like to draw. So we're going to be talking more about, the realities of med school and nursing school in our next video. So stay tuned.
So we're going to see you guys again and talk more about that next week. But before we go, if you can describe your winter term in one word, what would it be?
What would it be? Mistakes. I feel like
that's a deep one.
I know. I feel like I'm making too many mistakes last term, and I guess I had a tiny regret, so to speak. But now that I know what I need to work on, I'm actually excited to change my ways and see how next term goes. So and I'll say this: rule number 1 for college in terms of lab. If you realize that you have to go somewhere on the day of your lab, number 1, either change your lab to another day, or number 2, talk to your head TA about it as quickly as possible with the notes, because oftentimes they're not very lenient to change your lab days. So,
especially I think because they have to prepare everything, like before the lab, so that's a little bit harder. So that's a good note.
What about you?
Yeah, so now that you talk about mistakes, now I'm like thinking all of the mistakes. But I think in the end, it was, but one word to describe my winter term, it was fun.
Oh, okay.
Yeah, I think last term was kind of like a little, break before I'm going back to my heavy science classes next term. And I think I did procrastinate and such, but which I will fix. See, I'm talking about my mistakes, but it was fun because I learned a lot. It's really cool when I can apply what I learned. I know that when we're learning OChem and such, we'll apply it later, though it helps, but we can actually do it literally later. But the things that I studied last term, some of them are very applicable, and I've been sharing it with other people and then help their life. It's just so cool, and it motivated me to oh, this is why I want to do healthcare. That feeling of oh, I'm able to make this person's life better. So yeah, that was fun.
Nice.
Yeah.
Well, stay tuned to our next video, and please comment down below. We're happy to receive any comments, in order to improve our videos or to make sure that we cover the things that you want us to cover.
So we'll see you next time, and thank you for watching. Bye, guys.